All right. Well, hi everyone. I hope you had a great Thanksgiving holiday and certainly wish you all a wonderful holiday season. So we are seeing still that trend up with our COVID patients. Today in our system, we have 44 isolated COVID patients across the St. Joe, Maryville, Albany. Here in St. Joe, we have approximately 36. The majority of those are up on the main floor. We do have 5 in our ICU at this time. We have 6 patients isolated in Maryville and 2 patients isolated in Albany. Testing has been being requested at a much higher rate, especially starting since the Thanksgiving holiday. We had seen it bumping up over the last few weeks, but really we have seen a large jump, an increase in people requesting testing for COVID because of symptoms. And we are also seeing an increase in the number of infusions we are giving for the monoclonal antibody. We have a medication that if you do test positive and you meet criteria, we try to give this to you to prevent hospitalization. It does work very well. It is not 100%. Still, to date, we believe that the best means of protecting yourself is with vaccination. There are some medications that are being looked at by the FDA. However, they have not received any type of approval yet, and those would be the antiviral pills. So they have not received any type of approval. The government's looking at that. We expect that the middle of this month. Again, though, vaccination, we believe, is the best way to help prevent, and these other treatments we use to supplement so that hopefully you don't become severely ill and succumb to your disease. Our 2-week running positivity rate is about 24.5% roughly. It will be a little higher than the county just because we take a 5-county area. I've explained that in the past. I am very happy to announce that our vaccination rate here at Mosaic across the organization is just slightly past 92%. That is very good. We have mandated vaccination. The deadline to start vaccination is December 5th. We are following the guidelines in regards to getting a waiver, whether it be based on religious beliefs or whether it be a medical waiver. We do have committees that do review these, every one of them, as to whether or not they would be granted. So hopefully we will continue to see that our caregivers do get their vaccines, and those that get waivers will require some testing. Even with the recent judge's ruling about shooting down the Biden mandate, that will not deter us from proceeding forward. You just don't know where this is going to litigate out, and we are following what we were initially told by CMS were their recommendations for the time frame to which have your caregivers vaccinated or have a waiver. Another question has come up, I've been asked, is about the Omicron variant that is now the predominant variant in South Africa. We do watershed testing here, the state does, and it is reported to us, and the health department sends me those reports. To date, none of this virus has been detected in Missouri. That does not mean it's not here. It only means that it hasn't been detected either through watershed, and I don't know of any reported case to date, especially here in the local area. However, it's only a matter of time before it gets here. The way this virus moves through the population and around the world, by the time South Africa even was able to identify and report, we know it was already in multiple countries around the world. And we know that I know of a couple of cases in Canada, so I do believe that it is here in the U.S. And we will just have to see. It is way too early to tell. Is this virus more lethal? Is it transmitted more easily? I know that many of the talking heads in the media want to talk about this and make all these predictions. We just don't know. What we do know, it exists. We do know variants and viruses occur. They occur every year. Obviously, they occur with influenza. And so it's important to monitor, and as more information is available, then we will certainly pass that on. Influenza, we are seeing influenza, and we're seeing a slight uptick. However, our cases are far lower than we'd seen a couple of years prior. Remember, last year we saw very little influenza. We are seeing more cases this year, but again, it is still at a low degree. But remember, influenza is very contagious. And what are the things we can do to prevent transmission of whether it be COVID or influenza? Wash your hands, be conscientious, the social distancing, watching what groups you're in, get your vaccines. Okay, influenza vaccine is available. You need to get your influenza vaccine. You need to get your COVID vaccine. You need to take care of yourself, because we want people to have a happy holiday season and enjoy the times with their family. So with that, I'll open it up to questions.
Just a quick clarification. With the 92% for vaccination, is that received one dose, or is that fully vaccinated?
That is received at least one dose.
And then I guess a follow-up question on that is, obviously 92% is a good number, but that I imagine that losing 8% of employees would still be a decent hit on the operations here at Mosaic. What would be, I guess, what's the step for that 8% following the December deadline?
So Clayton, you're kind of putting the cart before the horse. With that 8%, you've got the number. Certainly 8% of folks have not received this vaccine. That does not mean that they are not either scheduled or have been granted a waiver. We do expect to lose a small number of folks from our workforce, but we believe that number to be very consistent with around the national average that many other healthcare organizations have seen, which is around the 1 to 2% range. We are obviously hoping 1% or less, but people still have an opportunity. We have vaccination clinics every day up until Saturday. We are calling folks to find out, do you want to get the vaccine? When do you want to get it? Making sure that if they have applied for a waiver, that they would be, making sure they get their paperwork in so that we can evaluate and see. We do know there's going to be a small number, so that 8% goes down dramatically based on the number that are already scheduled and those that will get waivers. And we look like we're going to fall in the national norms there.
Dr. Turner, you talked about going ahead with vaccination, even with the Biden mandate in the courts. But is the Mosaic requirement separate from the federal requirement? Weren't you requiring your workers?
We were basing our requirement. We had already decided to require even before the federal mandate came out, and we decided that we would follow the guidelines set forth once they were identified, which CMS identified a timeline, and we're going to stay to that timeline. We're following what that had said, and we're not changing based on that. It's the right thing to do for the patients that we care for. The needs of the patient come first. And it's the right thing to do for our workforce, whether they get a waiver through religious, medical, or they get vaccinated.
So regardless of what the courts decide or what the Biden mandate is, Mosaic is going to require workers to get those vaccines.
Just like we require for the influenza vaccine, we are requiring the COVID vaccine. That is correct.
For the waivers, do you know how many of your caregivers have filed paperwork?
Right, yes, I do. I'm going to get close on the number. It will not be exact. Roughly, we will have 300 to about 350 folks with a waiver of some type across the organization. And that's that's about the number that we believe, give or take. I know that we are still evaluating. I know over 250 waivers had been granted, and there were still about another 60 to 100 to evaluate. Roughly, they're in the process of doing that. Do you have another question?
Yeah, I mean, obviously, we kind of touched on this a little bit with the holidays coming up. It's officially December, but we are seeing these cases rise. We're hearing of this new variant, and also our hospitalizations are up. What are we suggesting for Christmas and the holidays? Because, I mean, do you think that this is kind of a result of Thanksgiving, or is it too soon?
We've really tried to look, is there one specific thing we can tie this to? Obviously, it's too soon to say this was Thanksgiving. These numbers were already going up. School's back in session. It's getting colder. People are going out and buying things and being in larger groups. Are we as vigilant with our hand care? Are we as vigilant with our social distancing? Are we as vigilant with wearing our mask if we're going to be in one of those arenas? So right now, we're going to have to learn to live with COVID. COVID's not going away. Influenza's not going away. COVID's not going away. We have to learn how to live with it. So we have to learn how to protect ourselves and take care of ourselves and our loved ones. And so we want people to be conscientious, thoughtful, take the right precautions. Again, we still do feel the vaccine is the best means to protect yourself. We do believe it will be somewhat effective against the new variant, even though there's changes, but we don't know for sure. But we believe there will be at least some protection. So we want folks to be able to spend a happy holiday together. But again, follow those rules around, taking care of yourself, protecting yourself, washing those hands. And I think a lot of this has to do with, it's been 2 years now. It's a long time. And we just have to figure out how are we going to live with it and how are we going to move our lives forward.
How would you characterize the strain on the Mosaic system with the increase in hospitalizations?
Right now it's a moderate. If you remember at our peak, we had in isolation at our peak right close to 198 isolated. Now, on top of that, we had about another 40 that had been here over 21 days. That was at our peak. Our volumes are running high across the whole system. Today we're at close to 270 people, I believe, in the hospital. And of those 270, 36 of them are COVID patients. That equates to a little over 2. So when you put that math in, we're running close to 300 patients in the hospital just from a manpower need. So that does put a moderate stress on our staff and our caregivers who are working long hours and helping out their fellow caregivers, and that's across the board. I sometimes feel like I sound like a broken record, but it's everyone. It's our environmental services folks cleaning the rooms, trying to help people not have to sit long times in the ER or in the clinics waiting for admission. Our cafeteria folks who are putting the meals together to not only take care of the caregivers that work here, but all of our patients and the visitors that we still do allow. So it is moderately stressful, and if the numbers can continue to go up, it's going to continue to cause increased stress. But we're here for the community and to serve the community, and our caregivers are here to serve that community, and we're going to find the ways to be able to take care of them.
Just a question on hospitalizations. Is it still the Delta variant?
Yes. So the watershed right now in our area still remains 100% Delta. There are some areas, I believe, down in the Boot Hill range where we do have some different variants, but they're variants that had been around, but they're still seeing some Alpha. Here we are still 100% Delta, and certainly we would let you know when that changes. But I just saw the report today. We are a hotspot. I did see the report today that does confirm that the state confirmed it is 100% Delta, and the question was asked, will they know when this variant is here? And they said, yes, they're able to test for it, and they are watching for it. Clayton, I thought you had another question.
Yeah, I know that at the peak of COVID hospitalizations, another concern was just staff being quarantined and having to miss, and kind of some of the stress that's put on the staff. With the 92% that you've seen and the hope for that to increase a few more percent, has that had a positive impact on not losing staff to quarantine and kind of being more well equipped to to go battle against this virus staff-wise?
Sure. We have seen less staff members have to take time off either because of COVID or because of quarantine based on that. But predominantly, if you've been vaccinated, as long as you're asymptomatic, you're able to come to work. It's the unvaccinated with a very big exposure that we have to weigh. Are they symptomatic or not? Can we test after a few days to see? We have 32 caregivers out right now, either with COVID, recovering from COVID, or on isolation for some reason, which for where our numbers are, that's lower than what we had seen previously a little bit. So we are seeing benefits from the vaccine, and we certainly hope and believe that as we finish through our vaccinations, that we will see those numbers not be as high. Now, we are, as I said, we have to live with this, and we will continue to have caregivers that get COVID and will be out of work, and we will continue to see COVID in our community.
Are you continuing to track breakthrough cases, and is that going to be kind of a way to see the impact of this potential other variant too, if some of those breakthrough cases start to increase?
Yes, we continue to watch breakthrough cases in our caregivers. We also continue to, anyone who gets admitted, what was their vaccination status, and we do continue to trend and follow that. And I know last time when we spoke, I had a number. I don't have that number today, and I apologize. I don't know the number of patients in the hospital that are breakthrough cases that have been fully vaccinated. So sorry about that. I don't have that number today.
In comparison to where we were a year ago, could you characterize how the hospital feels? Because like you said, we were nearing 100 hospitalizations. We didn't have the vaccine at this point. It kind of felt like doomsday.
Mm-hmm.
Are you guys feeling more hopeful for the future? I mean, you said we have to live with it. Cases are rising, but is the hospital looking forward to everyone being vaccinated? I mean, what does the future look like for Mosaic?
I'm going to tell you personally, I am more hopeful because we have more abilities to treat this disease or protect you against it. Vaccination, obviously. These new antivirals, once they're approved orally, like similar to a medication you might take for the flu, that's going to give us more ability to take care of folks that have this and protect folks. The infusions that we're able to give, the monoclonal antibody infusions, we continue to give those at all 3 locations. We are presently filling every infusion slot for the last week that we have available. We're actually expanding. But it still gives us hope because we have something we can actually treat patients with. When this first started, we were able to treat them with supportive care, and if they had complications, we could treat that complication. Otherwise, COVID had to run its course. So now we do have, we have other means by which we can treat these. It does give you a bit of optimism, but it does wear on us. It's still very intense, causes a big drain on staff from a standpoint of just the number of folks we have to take care of them. And they become our family because so many of them are here for so long. And you become part of the family. And those cases, whenever they don't survive or really, really, really do hurt, it's almost a moral injury to your caregivers.
You talked about an increased interest in testing. Have you seen any increased interest in vaccinations?
Obviously, with our numbers, we're seeing increase, but a lot of that has to do with the mandate. We are seeing a lot of folks get their booster. We did have a couple of clinics. We had a lot of folks coming in to get their boosters, and we had several first-time vaccines. We didn't turn any of those folks away. But overall, since we're not running our mass vaccination, that would actually be something some of the local pharmacies, I don't have that information on what they're seeing from an uptake of vaccine. I would say we saw some increased interest, and we did have people show up to start their vaccination series at our recent more mass vaccination booster events.
What's Mosaic's recommendation on the booster?
Right now, we're the same as what is being recommended. We recommend you get the booster, especially if you meet the criteria. We recommend, right now it's open to everyone. I will tell you, especially if you have any comorbid diseases or you're 60 and up, you really want to get your booster. We are still seeing the largest number of breakthrough cases that have bad outcomes are 60 and up, or you have cancer that you're going through treatment for, and that really is age indiscriminate. Or if you have other comorbid conditions, diabetes, high blood pressure, if you're way overweight, lung disease, things like that, those folks are at the higher risk. But that 60 and up group, you really want to get boosted. And if you're in a high contact area, such as healthcare, or even school teachers, and because we know a lot of those kids are asymptomatic, and you want those folks to make sure they get their booster. And I would say everyone, if it's available, you ought to get it. If it's been 6 months since your last shot, get the booster.
Are we planning any more clinics, boosters, or just general vaccine clinics as we approach the holidays?
I want to say that we were looking at one, but I don't
We're
have the
looking at a
date.
date in December.
Yeah, we
We'll
are.
announce it soon.
Yeah, I don't have that date today. So
That's all my questions. Yeah.
everybody pretty much okay?
Yeah. Thank you.